I'm one of the volunteer of the OPARA Foundation. So, sir, please, can we meet you?
Okay, you're welcome. Yes, my name is Dr. OPARA. I'm the founder and CEO of Dr. OPARA Healthcare Foundation.
Hi, sir. Too. Can we meet
Okay,
you?
I'm Mr. Godwin Akman,
Okay.
M&E consultant and partner with Dr. Bara Healthcare Foundation.
And sir, Dr. OPARA, what can you say about SWRR program?
Okay, SWRR is Sex Workers Reskilling and Retooling Program. The program came into existence in 2022. We found out that because of the economic hardship in the country, a lot of our young girls become vulnerable, because of so much hardship and the way things are going in Nigeria. So a lot of our young girls were taken into uh, wrong behaviors. So we felt that as a foundation, we should be able to put in our best to prevent those who would have entered into such a vice from entering. And then those who are already in can be able to at least give them a skill so that they can live much more better life. So we started that program to help the young girls, yes, not to enter into the sex. And we are so grateful to Nigerian Youth Future Fund, Ford Foundation, and Mercator Foundation, and some other good-spirited individuals home and abroad who have identified with our foundation in making this project come to fulfillment. Right now, we have about 38 people who are benefiting from these programs, and many of them, as we are doing today, they are graduating from the first phase. This phase started in November 2022, and yes, we are ending it this November 2023. Yeah, so most of our beneficiaries are graduating today. Some of them who have chosen skills that they need more years to learn are still in the program. There are some who are going to be 2 years, there are some who are going for 3 years program, so they are still. So today we are just uploading the first batch who their program is ending in 1 year. So that is what we are doing today. Yes.
Okay. Sir, what is your role in this WSRR?
SWR.
SWRR, what's your role?
Well, our role was to monitor and evaluate the entire program. It's a very sensitive program, and there were several components that are aligned with monitoring and evaluation, in line with the policy of the funders, Dr. Para Healthcare Foundation, and the sponsors. So we were following up on the terms of reference and the engagement to see that Dr. Para Healthcare Foundation actually follows the work plan that have been designed with respect to the program. So that's our role.
Okay, Dr. OPARA, please, what is your assessment about the OPARA Foundation since inception?
Yeah, the Dr. OPARA Healthcare Foundation started in 2010, and the reason behind we starting this foundation is to bridge the gap between the lack, in accessing healthcare by our people. Because of the JAPA syndrome, a lot of doctors and nurses have left the country. And because of our large population, the patient-doctor ratio is widening. Right now, one doctor in Nigeria sees over 3,000. It's a ratio. So we notice that there is so much gap. Our people are no longer accessing quality health care. Most of our hospitals in the rural areas are just, they are in comatose. The infrastructure decays so much. So the doctors, most of them don't usually go into the rural areas to practice. So
Yes,
a
but
lot
if
of
you're not seeing money or something like that.
yeah, and because of poor infrastructure, no doctor wants to go to a place where there's no light,
Yes,
there's no
yes,
water,
yes.
and you've seen the high level of insecurity.
Yes.
Doctors are being kidnapped. A lot of things are happening. So because of that, there are no doctors taking care of the rural people. So we decided to start this foundation to go into these areas once in a while to provide free medical services. That is the first thing we did. And sometimes when we go into these areas, we check on the infrastructures, the health infrastructures there. So any place we go in and the health center is not functioning, we try to raise funds to provide the infrastructure, activate the hospital, and make it function. Some places we have already started, put in place some hospitals, and then the hospitals are.
What they do like that now? You do like that as if now this thing.
When we get to a place where their hospitals, the infrastructure is not in order, it's not working, we try to fix them and activate them. Like in some places now, we have fixed, like in the health center in Afotogo, we have fixed that, and we even put in some health workers who the foundation is even paying. They are taking care of it. So we are also fixing some other hospitals in Kogi and in Niger. So this is the reason why we started the foundation. And so far, we have also been taking care of people who are living with HIV and AIDS. With Solina Healthcare in partnership, as a foundation,
But
we
helping them
are.
with some drugs or advice or how do you help with HIV? Yes, you're talking about.
Yes, the Solina Healthcare Foundation provide the drugs,
Okay.
and we, partnering with Diamond Crest Hospital,
Okay.
we provide the health personnel who assess the laboratory needs of these patients, and we also give them antiretroviral drugs. We take care of those pregnant women who have HIV. We treat children who are with HIV, and we treat adults who are with HIV. We also do sponsor a lot of girls in the nursing school. School of Nursing free, give them scholarship. So we identify some young girls who are smart, who are also vulnerable, who doesn't have people who will sponsor them. We have started giving them a scholarship. Some have graduated, some are still in their schools where they are training right now.
Okay.
So this is what the foundation has done so far, and I believe that we are in the right track, and with the sponsors we have really done well.
I think God help you. So, Mr. Godwin, please, do you have any challenge?
Well, there are several challenges that were captured right from the inception, and we have tried to mitigate most of the risk. And the major area of concern has been the funding. We had a little constraint in meeting up. That is why we have to make them in batches. We have the first batch that is finishing today, especially on vocation. But there are those that will extend, just like Doctor said, to 3 years thereabout, especially on specialized medical field. So the constraint now, that phase is a first stage of those that have successfully finished the reskilling. Now we are now looking at the retooling. The retooling will need what they will use to start up their own business. The machines, the place they will rent to be able to meet up their daily living and be able to partner, empower others and train them, because we are looking at a sustainable basis, and we are also looking at widening the scope through people we have trained. They also become a trainer who will now retrain others. So, but the constraint virtually now is about the retooling. The retooling is what we are also looking at, and we are appreciative of how far our sponsors, those sponsors have gone. We are so much encouraged, because initially it had just been Dove on its own, but now the sponsors have come and then they have given their support. We deeply appreciate it. But we are also looking forward to a scale up, because like he earlier said, not everyone was captured in the first stage. There are those that are still on the pending list. So we are intending that those ones will also be captured. And like he further said, some that are trained, are giving capacity training, are receiving background experience from the hospital, are also waiting to receive, to have access to School of Nursing, where they will now learn more and become qualified and certified health medics. So we are looking at sponsorship in that area so that this program will continue. The program has been on and is on a sustainable basis. So we look forward to deepening partnership with our sponsors, and we are hopeful that God will see us through.
Amen. Don't worry, everything will be alright. Also, OPARA, how do you feel about the sponsors of this program?
We are very, very thankful. We are very, very grateful to the sponsors. Since the OPARA Healthcare Foundation started, this is the first time we are really getting a sponsor. The foundation has been partnering with the Mount Crest Hospital and Golden Bliss Hotel Michelle. And then when the HIV program started in the foundation, we had a partnership with SWRR Health. But this is the first time that the program is being sponsored by an established body. So we are very grateful to Nigerian Youth Future Fund. We are very grateful to Ford Foundation. We are very grateful to Macanto Foundation. And we are, as the man guy said, we have a lot of young girls who need help, especially in Nigeria right now. The way things are going,
Yes, things are not easy.
yes, so
Yes.
we need scale up. The 38 people we started with, they are the fund that we got was not. It was very, very helpful, but we need more assistance so that we can bring in a lot of people into the program who really need it. And also, as he said too, some of these programs is running into 2 years, 3 years. So we still need funds to be able to sustain those who are going to for the 2 years and 3 years program. We thank God for the exposure. We have got from this um, sponsorship. Yes, we had a lot of exposures. We had a lot of contacts with different people who have been mentored and who have been, exposed in the day-to-day management of programs like this. So we are really very grateful.
Okay. So, Mr. Godwin, what's your view on the OPARA Healthcare Foundation and SWRR impact assessment?
Well, what we will say is positive, and going by the assessment, the people that have passed through the first stage, we have seen remarkable changes in their life. We have noticed remarkable changes in their life. We have also seen the comfort of their needs being identified, particularly by those who they have not known before, coming in to identify their own personal struggles, stepping in to also assist them. The impact has been much too, because it has not only been impacting to the beneficiary, we have also seen an impression that has given rise to a clear-cut perception right from the immediate, from interaction with them. Their conversations has also narrowed down to an initiative, to this program as a laudable initiative which they will want to be part of, and to see how it can actually be sustainable. So we are also looking at regarding the impact. We are also looking at it having a sustainable, going on a sustainable basis, and then we look at the new other people that have not yet been trained also receiving the training. But as we could literally say from the M&E standpoint, the first batch have only received rescaling. What is now necessary for those of them that have graduated is to receive the retooling part of it. It is at the instance of receiving the retooling part of it that process has been completed. So we are soliciting for more support from our sponsors, and we gladly appreciate the ones they've done already.
So, sir, where do you see the OPARA in 10 years to come?
In 10 years' time, we are looking at where, as regards sex workers reskilling and retooling program, we are looking at where we have been able to reskill at least thousands of young girls. Yes, this program is not sex workers only. We are talking about those who are vulnerable. We have 80 or 90% of people that we are targeting are those who are vulnerable. Probably they are orphans, probably they are we have a situation where we have 40 people, 30 people in a family. Yes, so yes, can't send them to school. So these are vulnerable people. We want to get them to have skills. Some of those who can go to school, we send them to school. So this is what we are targeting for this program. Then for the health infrastructure program for the OPARA Healthcare Foundation, we are looking at where we can be able to activate so many moribund health centers we have in our rural areas. We are looking for partners where we can be able to at least activate a lot of hospitals, provide working staff and tools for those hospitals so that most of our rural dwellers can be able to access quality health care. So we need partners in that field. We're also looking at where we can be able to, at the end of the day, because this is a medical healthcare foundation, we are looking at where we can even be able to set up our own nursing school. We're looking for partners who can partner with us to set up nursing school so that we can be able to train most of these girls who want to go to school of nursing in our nursing schools, at least with scholarship. That will reduce the funds, and then the program will have a sustainability. So if we can be able to have that, that would be very nice. We're also looking for partners, both inside Nigeria and outside Nigeria, who can partner with Dr. OPARA Healthcare Foundation in all the activities we are doing. So we're looking at where in 10 years' time we would have touched a lot of lives. A lot of people have gotten skills. A lot of people have gotten tools to work. It doesn't just end in getting skills. We need to also see them have tools and they are working, in their various places. And we can also send those who want to benefit from them to them so that they can be able to train them, free of charge. So we are looking at in 10 years' time where we'll have trainers who are beneficiaries of this our foundation. We are looking at where in 10 years' time we'll have a lot of nurses scattered everywhere in Nigeria, outside the country, who are also beneficiaries of the program and who will also be partners in what we are doing. So we are looking at a future where we'll have partners where we can be able to work together, activate most of our health centers that are not working, provide medical personnel to those places, and at least put a lot of smile to a lot of Nigerians who are living in anguish right now.
Okay, all right. Thank you very much. I really appreciate you, Mr. Godwin and Dr. OPARA. Nice meeting you, sir. May God bless you and may God strengthen you more.
Thank you.
I really appreciate it. All right, sir. Have a nice day.